Hello. APIs are the biologically active. Now let's look at a couple of examples. Take aspirin, for instance. The API in aspirin is acetylsalicylic acid. It's what provides the pain-relieving and anti-inflammatory properties. Another example is ibuprofen. The API here is, well, ibuprofen. This ingredient is what makes the drug effective in reducing pain and inflammation. Some other example. Acetaminophen, Tylenol, relieves pain and fever. Ibuprofen, Advil, reduces inflammation and pain. Amoxicillin, fights bacterial infections. Metformin, glucophage, controls blood sugar levels in diabetes. Atorvastatin, Lipitor, lowers cholesterol level. There are two main types of APIs. Synthetic API and natural API. Synthetic APIs are created through chemical processes in the lab, while natural APIs are extracted from natural sources, like plants or microorganisms. Regulatory agencies worldwide set strict guidelines for the production of APIs to ensure they meet quality and safety standards. This ensures that the medications you take are reliable and safe. Manufacturing APIs can be complex. Challenges include maintaining purity, consistency, and scalability. Pharmaceutical companies invest heavily in research and technology to overcome these challenges. Did you know that the API aspirin was originally derived from willow bark? The API penicillin was discovered by accident when a scientist noticed that mold was preventing the growth of bacteria. The API morphine is derived from the opium poppy plant and is a powerful pain reliever. The API insulin is essential for people with diabetes and helps regulate blood sugar levels. The API atorvastatin is a statin drug that helps lower cholesterol levels and reduce the risk of heart disease. So, there you have it, a glimpse into the world of active pharmaceutical ingredients. These tiny components play a huge role in the medications that keep us healthy. If you found this video informative, don't forget to hit the like button and subscribe for more insights into the pharmaceutical world. If you have some questions, suggestions, or enquiry, let's come to the comment box. Signing off from the Pharma Greeks. Keep learning.